In this video, we are going to be looking at the topic simulation. Hi, I'm Sharon. I'm working as an assistant professor at MMM College of Nursing. The following are the objectives that we'll be addressing in this video. Now, let's look at the definition of simulation. It is a process by which we are trying to achieve results approximating clinical practice as closely as possible. It creates a situation or environment to allow persons to experience a representation of a real event for the purpose of practice, learning, evaluation, testing, etc. Let's look at the importance of simulation. It enables the learner to learn directly from experience. It promotes high level of critical thinking. It develops in the students understanding and decision making process. It enables the individual to emphasize with the real life situation, provides feedback to the learners on the consequences of actions and decision made, motivates the student by making real life situation exciting and interesting. It also enables the teacher and the learners to assess the realism of the situation by uncovering misconceptions. Now, let's look at what we can learn or train in the simulations. It helps in learning the management of the patient, learning the technical skills, how to work in a team, how to initiate and continue the communication as well as end it. Competencies concentrated on patient safety can also be addressed. It also helps in testing new hospital protocols so that without affecting the real patients. Now, let's learn why is simulation and what is it done for. So, the aim of simulation is not to catch the learner in a mistake or to prove that the learner cannot do the procedure or does not know something, but it is to give the opportunity to train all the skills of the procedure practically and also to give the opportunity to repeat the steps many times as necessary to learn them properly and to focus on the process of learning. Then, it also further helps to learn from the mistakes in a safe learning environment where no harm is done to anyone, which is very important and crucial. And it also helps in learning to give as well as receive feedback. Now, let's look at the pyramid of learning with regard to the average retention rates with the basis of the teaching methods. So, here we can see there are two types of teaching methods, that is passive as well as participatory. Under passive, we have four methods. The first one being lecture, where the retention rate is only 5%. The second one, reading, where the retention rate is 10%. Audio visual method, where the retention rate is 20%. And the last one, demonstration, where the retention rate is 30%. But we can see that the percentage increases in the participatory teaching method. So in that we have the discussion group, which has 50% retention, practice by doing has 75% retention, and teaching others has 90% retention. So here simulation, the topic that we are discussing right now, comes under the participatory teaching method because there is discussion, there is practicing by doing as well as teaching others. So here the retention rate will be better in comparison to the passive teaching methods. So this is the main advantage of choosing this method of learning. Let's move on to the principles of simulation. So we'll be addressing each of this in detail in the upcoming slides. What are they? Feedback, deliberate practice, curriculum integration, outcome measurement, simulation fidelity, skills acquisition and maintenance, mastery learning, transfer to practice, team training, high stakes testing, and instructor training. Let's look at the principles one by one. The first one being feedback. This is the most important feature of simulation education. This produces long-lasting learning It allows the student to develop a deep insight and reflection and slows the decay in knowledge. The next one is deliberate practice. It refers to the intent of the learner in engaging, also includes motivated and concentrated learners. There should be well defined learning outcomes. There should be repetitive practice to enhance skills acquisition. There should be rigorous measurement of outcomes. The evaluation process must be there to ensure students achieve mastery. There is also a plan to advance to the next step to allow for continual development. The next principle is curriculum integration. This is not the silver bullet, but rather it is one education modality. This should complement rather than override the curriculum. Further, looking into the principles, outcome measurement. This principle helps in providing both quantitative and qualitative outcomes, but there can be intrinsic biases in the reliability, especially with the observational ratings of the learner performance as well as the learner's own responses. Hence, it is necessary to identify a valid and reliable method of outcome measurement. Next is simulation fidelity. So, here it requires matching the real life task with technologies that allow the best possible mimic of this environment. Next is skill acquisition and maintenance. It allows for a repetitive practice of skills that in real life clinical contexts may be haphazard as well as disjointed. May include surgical skills, procedural skills, or approaches to management. Example, primary survey in trauma, ACLS, and CPR. Failure to do so leads to skills decay without further practice. Next is mastery learning. It refers to rigorous approaches to competency based education that occur concurrently with deliberate practice. This includes baseline testing, defined learning objectives, engagement in skill activities, formative assessment, and a plan for advancement to the next unit. Let's look at the final set of principles, that is, transfer to practice. So, the skills must be able to be transferred from theory into practice. Team training. This helps in practicing non technical skills such as how to function in a team, teamwork, collaboration, and communication. Next is high stakes testing. Standardization, reproducibility, and fidelity of the simulation has to be taken into account because only then formative and summative evaluation of the competencies of procedural skills can be done. This also helps in assessing non technical skills including professionalism and communication skills. The final principle is instructor training. It is very essential. Clinical experience or seniority alone is not a proxy for effective training. Debriefing and feedback is necessary to allow maximal learning to be achieved from these sessions. Let's make learning effective and immersive by doing simulation. Hope you have got an intro into what simulation is. The following are the references. Thank you.